Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical. It's July the 24th of 2023, and I want to say good morning to you and let you know that we are here doing our thing this morning, and we're here to listen and help you if we can. Okay, so it's pretty interesting. Right now, I'm getting all my old videos from 3 years ago popping up on my feed through Facebook, and it's interesting to listen to those and to think about the fear and the uncertainty that we were all experiencing during that time when COVID was coming through the country and through the county here in Raven County. So it just reminds me how blessed we are that we're not having to deal with this much, or at least people aren't dying left and right as a result of it. On the same note, unfortunately, I have had a handful of patients pop up over the last few days with COVID-19. So there's a few things about COVID that I want to talk about. First of all, I've even missed a few where the patients come to me sick. I didn't even think about it, and then they went and did the test, and it was COVID. Nobody appears to be dying from it. Okay, in other words, the people that had it, none of them are in the hospital. Number two, bad, and number three, I don't know where they're getting it from. I do know that I had some patients who've been on cruises or been over in Europe, and they came back and tested positive for COVID. So it's definitely still lingering around. I don't think there's anything legitimate you can do to prevent it because it's scarce, and I don't know if going full on with protective gear would actually be reasonable at this point. We don't offer the testing here anymore though. Okay, so we can do the Nares test, which is get back in 3 days, but that confirmatory test that you want, you need to do a rapid test, and you can get the rapid test from the pharmacies, and I think your insurance pays for you to have so many of them, which is fine with me. However, we have had a few people who wanted to get that test and wanted us to administer it for them, and we've done that, and I don't mind doing that for a few people just to make sure. So just be mindful of it. Always use your hand sanitizer, because I think that's like the most legitimate way to mediate the spread of any virus in this community or anywhere. So sorry to let you know that. I'm not excited about dealing with COVID-19, but it is still around. It does not appear to be life-threatening, and I'm not sure I recommend any kind of intervention at all at this point. I do want to tell you we've got LifePoint Medical University up and running, where it's going to be a subscription service for some people who would want to join us on our learning adventures through the next year or so. It's going to be pretty neat. I've got all my providers geared up to be able to do it. The thing is we're going to be able to provide you with good, up-to-date information from a reliable source. And I know some people are interested in that because I've heard it for years. If you're interested, go ahead and sign up. And I'm going to provide the URL again today on this visit, or on this blast that I do this morning. All right. The last thing I will talk to you about, this is another just a housekeeping thing. As a doctor, when I order something or I get something done for you, I set up a feedback loop, or a loop to close, and that's done through the computer. And that goes for any order that I put in for any patient, anytime, whether it's in an outside facility or an inside facility. We have a loop, okay? And we're constantly monitoring that loop to make sure that whatever we send out gets done and gets addressed appropriately up to the point of giving the results to the patient or discussing the results with the patient. So we're very diligent about it, okay? But it is massive. Like, we're not talking, 10 or 20 messages. We're talking between 100 and 1,000 that we have to deal with, let's say on a daily or a weekly basis. Okay, so it is massive. So that's what we do to try to make sure we have accountability for what's going on, and we've got that feedback loop so we don't miss anything. But I will tell you that I'm getting on a daily basis patients who are having stuff done from other people, and that loop is not being closed. And I'm not making excuses for other doctors or whatever. I'm not making excuses for me. It's just that's the logistics of how we have to do things, and I'm fearful with staff turnover and people struggling administratively like they are now because of work shortages and things like that, that these loops are not being closed with other people. So I just want to remind you that first of all, if you've got one of those loops that hadn't been closed, like you had something done here and you're waiting for the results, and it seems like we've dropped it, we're not doing what we're supposed to do, call us and tell us, hey, I've got an outstanding thing now, and an outstanding order or test, and I really want it done, and we'll automatically make an appointment, and we'll get you seen and get you taken care of to get that taken care of, or just tell you that it was nothing, there was nothing wrong, something along those lines. The thing I'm worried about more than us is the outside world. Like, so if you're going to another doctor, going to another facility, you're getting something done and it doesn't get back to you, you've got to be the one that makes that happen. And we want to help you as your primary care physician. If you've got struggles that way, we can help with that. Okay, but we definitely won't. The problem is we don't know what you have or hadn't done, so we may not know to intervene appropriately. But if you'll let us know, that's part of our agreement with people, and that's part of that chronic care management that we're doing, is to help you get the information you need and close those circles, so that if you get something done and you don't hear back from it, somebody should be talking to you about it, either telling you it's normal or telling you you need to do X, Y, and Z to address it. So we're on top of our game, or trying to be, when it comes to that here, okay? But we're also your advocate outside of this facility and with other doctors to help you get what you need and close those circles too. So if you need us on that, first of all, try to seek it yourself, but if you can't, we're here to help you with that too. Well, this is Dr. Timothy Scott Beck talking to you today. Our telephone number is 706-782-0180. And our text number is, I keep forgetting the text number, but you can text us from our website, drtsbackmd.com. Our texting line is 706-607-6685. If you'd like to text us to that line too, we'll respond that way. Look, we just want to get in touch with you. We want communication. We want to help you if you need help. And communication is the key to everything. So work with us and we'll try to work with you on it. Have a great day. Call us if you need us.